Today on a Dr. K call, we are going to talk about direct anterior hip approach. Hip arthritis is a serious condition that really debilitates you. Most people complain of groin pain, and that's the most typical area of pain. People think that the pain in their back is due to the arthritis, but it's really tends to be more groin pain. And one of the life-changing procedures that you can have is a total hip. Now, total hips are done in several different ways. You can do a posterior approach, a lateral approach, or an anterior approach. Traditionally, posterior approaches were probably the most popular, but gradually over the last 10 years, it has changed to more and more surgeons doing anterior. The reason for that is there seems to be less pain, and there's some literature now showing that, some studies showing that, and the recovery is faster. And the reason for that is that approach is very much, your hip is very much closer to the front than to the back. And so when you're going through the front, you're going between the muscles and between the nerves that innervate those muscles. So there's very little denervation, and your muscles tend to recover faster and they function better. Now, posterior and lateral approaches also give very good results. The posterior, the biggest kind of common risk is dislocation, which is not good. That's not a good thing, but any hip can dislocate from any approach. The lateral, they tend to limp more because you go through some of the big muscles that control your hip. And the anterior, bleeding tended to be a bigger problem, but we now have drugs that kind of prevent that. And then the learning curve on the anterior hip is perhaps a little steeper, and a lot of surgeons aren't necessarily used to doing it. So the anterior hip, the learning curve, when you first start doing them, there's a higher incidence of fracture. It takes a while to get used to it, and I think that's why a lot of surgeons perhaps don't undertake learning the anterior hip. I used to do them all posteriorly, and I would tell you today I would much rather have an anterior hip, and I think it's better for my patients. My patients recover faster. I do these now as outpatient, and they are walking out of the hospital or my outpatient surgery center 1 and 2 hours after the surgery. Now they're using a walker, and it's still a big operation, but it can be done as an outpatient. Uh, Long term, I believe it'll be better. There's a article out of Italy that looked at MRIs, and they looked at MRIs of posterior approach, lateral approach, and anterior 1 year out, and the most atrophy of the musculature was posteriors. Second was lateral, and then anterior had the smallest amount of atrophy. So long term, I think your hip is going to function much better, and I think it'll be better for you as a patient, although perhaps harder for me as a surgeon to do that operation. We do use a couple of things. We use a specialized table. I also use x-rays so that we can get your leg lengths as close as possible. And that's always another concern anytime you have a hip replacement. The bottom line is that you want your surgeon to do the approach that he or she is most comfortable with. So don't try to convince your surgeon to do an approach that they aren't used to. On the other hand, an anterior approach, I believe, is a great way to have your hip replaced, and I think that the recovery and the pain, the recovery is faster, the pain is less, and hips in general do very well. So I encourage you, if you do have arthritis in your hip, to get it fixed. Find a good surgeon and do it the way they are most comfortable doing it.